Madam Speaker, the story of humanity is defined by extraordinary achievements that centuries later are looked upon as having impacted the course of human history. 5 years ago, we saw one of these distinguishing achievements, the mapping out of the human genome, a discovery that pries open the door of possibility and presents an opportunity to advance the human race. The breakthrough in the field of genetics joins the ranks of momentous discoveries that have changed the face of medicine and science for centuries to come, like the discovery of the polio vaccine so many years ago. Last week, Senator Kennedy said on his Senate floor, he noted the mapping of the human genome may well affect the 21st century as profoundly as the invention of the computer or the splitting of the atom affected the 20th century. However, Madam Speaker, such discoveries and achievements do not automatically lead to these extraordinary breakthroughs. In order for us to fully reap the benefits, we must ensure that our social policy keeps pace with the advancement of our science. And that is precisely why I rise today in support of the Genetic Information Non-Discrimination Act. It has been 13 years in the making, and I am pleased that the House of Representatives is once again considering the bill today, hopefully for the last time, so we may send it to the President to sign into law. While I'm pleased we're taking it up, I'm saddened that so much time has been lost and that the march toward progress and discovery has been slowed. The Genetic Information Non-Discrimination Act is the culmination of a broad and bipartisan effort to prohibit the improper use of genetic information in workforce and health insurance decisions. It prohibits group health plans and health insurers from denying coverage to healthy individuals or charging higher premiums based solely on a genetic predisposition to maybe develop a disease in the future. Furthermore, it bars employers for using one's genetic information when making hiring, firing, job placement, or promotion decisions. Madam Speaker, the bill has been described as the first civil rights legislation of the 21st century. I think that assessment is correct because, with the exception of trauma, everything that happens to a person's body has a genetic component. From the color of our eyes to our height to the illnesses and disorders we are susceptible to, everything happens because of our genes. No one, not a single living human being, has perfect genes. In fact, each one of us is estimated to be genetically predisposed to between 5 and 30 serious disorders. The good news is that since the sequencing of the human genome was completed in April 2003, thanks to Dr. Francis Collins, who I'm happy to say is in the audience, in the galleries today, researchers have identified genetic markers for a variety of chronic health conditions and increased the potential for early treatment and the prevention of numerous genetic-based diseases. There are already genetic tests for over 1,000 diseases, and hundreds more are under development. Let me mention just two. Just this week, we heard from the newspapers that in London, and work that is doing in Pittsburgh, and I believe the University of Pennsylvania, has restored some eyesight to people who were exposed to a genetic disease that harmed their vision as children. To be able to restore eyesight is something none of us had ever dreamed of being able to do. But by injecting genetic material into the back of the eye behind the retina, they have received some sight. They believe that once they are able to do this in younger children and be able to increase the dose, that the success rate will be extremely high, and that in itself is such good news. Also yesterday, the New York Times reported that the gene has been isolated for osteoporosis and for fragile bones. I remember when we were fighting for the Office of Women's Health, the statistic we used for osteoporosis was that we spent between $20 and $30 billion a year. Now, this was years ago, 10 or 15, between all that much money to treat osteoporosis. At that point, we had no treatment for it. We just tried to, as best we could. We have, over time, achieved some treatments for osteoporosis, but think what would happen if once we find that gene, we are able to manipulate that gene or change it and prevent osteoporosis altogether. The great thing about this science is the limitless possibility to cure conditions of the human conditions without long hospital stays, without invasive surgeries, and possibilities there for an entirely new way for us to provide health care. Now, consider if these tests we know that can tell a woman if she has a family history of breast cancer, if she has genetic predisposition for at least the last 10 years. I've been told by women who are in that condition and also by their physicians that they have recommended to them that until a bill such as the one we're passing today becomes law in this country, they should not put at risk their health insurance, many of them the sole provider for health insurance for their families, or their jobs. We believe the estimates are that about 22% of Americans have already been discriminated against. We have numerous cases of people who've lost their jobs. So the most important thing to show what rank discrimination that has been is that having the gene is only predictive. It does not say that you are doomed to have it. Indeed, it could be 20 or 30 years away, if at all. To deny persons health insurance and employment on that kind of proposition is nothing but discrimination. Now, we know now that numbers of people are going to go out to get the tests that they need to be able to plan for the rest of their lives, constituents that we've all had with Alzheimer's who want to plan for their future. So in addition to improving health care for millions, it's going to give the scientists and our medical researchers invaluable insight in how to combat and even cure the diseases in the future. I don't think we're going to realize what a wonderful day this is for us until someone in your family who is faced with this, that you can have a cure for them. It is totally remarkable. I honestly believe that being here in Congress for 22 years, which has meant so much to me and for which I am so grateful to my constituents, that this piece of legislation and what we have done here is the most important thing that I shall ever do in my life, and certainly in my time as a legislature. I'm enormously grateful to everybody who has supported this and all the people who have worked on it all these many years, never getting discouraged, always working every 2 years, refiling the bill, getting all the co-sponsors, and fighting for passage. That wonderful day now has come. I especially want to give my thanks to my colleague, Judy Biggert, for all the wonderful work that she does. And with that, I reserve the balance of my time.